Perfect. Great. We're going to go ahead and get started and let people join. We've had close to 20 people register, so which is good. It's exciting. So we'll let them join. This is being recorded. I will send out a PDF of the slides and the recording and some other links afterwards as well. My name is Megan Ockett. I am the program director with Healthy Birthday Inc. Excited to talk to you all today about Count the Kicks, the Evidence Stillbirth Prevention campaign. We have a wonderful partnership with the North Dakota Department of Public Health, which is how I'm located in Iowa. We were founded in Iowa, but we're a national organization. But this partnership allows us to do trainings like this, webinars like this. The materials that I'll talk about today, you can access and order for free. Everything like that is because of this partnership. So with that, we'll go ahead and get started. Here's my contact information if you need it. I love hearing from you all. A little bit of housekeeping. I am going to turn my camera off for the majority and I'll turn it back on at the end, but I have some videos to share and it just helps kind of with my broadband and Wi-Fi issues. So like I said, this is being recorded. You'll get an email after this. Write down my contact information, but you'll also get it via email. I'd love hearing from you all how you're integrating Count the Kicks, how you plan to integrate Count the Kicks, what resources you might need from me, because then I can go ahead and take that back to the health department and say, okay, this is what we're hearing from the community. You guys are the grassroots. I'm located in Iowa. I can give you the tools and resources, but you're the one actually doing that work and helping us save babies in North Dakota. So with that, one of the first things I like to do is I'm not sure how familiar you are with Count the Kicks, but what I'd like to do is share this video from Good Morning America that aired in 2017 with baby Ruby. And what's really exciting about this is a couple of things. One, it's a baby save. And when I talk about baby saves, what I mean by that is we have individuals that have contacted us that have reached out to us and said, hey, I was using your app, or my nurse told me about Count the Kicks and I was, knew about it and knew I should be paying attention to my baby's normal movement pattern. I noticed reduced fetal movement. So I went in and they checked, the doctors and providers checked everything out, found out baby needed to be here sooner rather than later. And now my baby's here safe and sound because of that. So that's what I mean when I talk about a baby save. So this video highlights our free Count the Kicks app. So if you're not that familiar with it, this will give you a good overview of how it works. And then it really shares that mom to mom storytelling. Like when this aired in 2017, we saw a huge spike in our app downloads. And we know the importance of that mom to mom storytelling. We know the importance of those baby safe stories and how impactful they are. So anytime you have an opportunity, whether it's a childbirth ed class or your Facebook or social media on your organizational page, anytime you can share these videos, they're all on our YouTube channel. Absolutely, please do. So let's hear a little bit more about baby Ruby. This is slightly delayed, but you should still be able to hear it okay. If not, go ahead and use the chat and let me know.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
Life with their new baby Ruby is extra precious.
We have a healthy baby girl and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
So yeah, hopefully that just gave you a really brief overview of our campaign. So I said we're Healthy Birthday is the nonprofit organization that created Count the Kicks. So think of Healthy Birthday Inc. as an umbrella, and Count the Kicks is our main hallmark tool, our evidence-based tool that we implement. And so it's an evidence-based stillbirth prevention public health campaign. It truly is an early warning system for expectant parents. It educates birthing people on the importance of tracking fetal movement through our app, which we're going to talk about, or our pay-per-kick counting charts. One of the things I love most about this campaign is it's empowering. So it's kind of like that data download for a birthing person's intuition that they have in their phone saying, this is my baby's normal, or this isn't my baby's normal. I need to speak up and contact my provider. So it's empowering. In Iowa, where this all began, we are saving 1 in 3 at-risk babies from preventable stillbirth. And that's what we want to see happen in North Dakota, or even more than that. So let's just make sure that we're all on the same page. I know the majority of you are in maternal health, so you probably know this information, but I think it's always nice to kind of just have a refresher that we are talking about stillbirth today. And stillbirth is a loss of a baby after 20 weeks of pregnancy. And it's further classified as either early, late, or term. You can see those definitions there. And so on average, across the United States, 23,500 babies are born still every year in the United States. That's about 65 babies a day. So think of it more in terms of a busload of children, a classroom of kindergartners. And then miscarriage is usually defined as loss of a baby before the 20th week of pregnancy. And then infant mortality is death of an infant before his or her first birthday. So on average, around 22,000 infants die every year in the US. And so there's one big takeaway I want you to have from this slide, and it's the fact that we are losing just as many babies to stillbirth as we are to infant mortality. In fact, we're losing slightly higher. And what that shows you is that we do not talk about stillbirth like we do infant mortality. We do not talk about stillbirth prevention like we do back to sleep and, SIDS prevention. And that's not to underscore the devastation and tragedy that infant mortality is, but it's to show you that we need to be talking about stillbirth and stillbirth prevention just as much as we're talking about the importance of going to, laying baby down on their back and a fan and not running or not smoking. Things like that. So that's really what I want you to take away from this slide. And then while we don't go into this during this presentation, because we're talking about prevention, some of the likely causes of stillbirth are things like pregnancy and labor complications, problems with the placenta, birth defects, infection, umbilical cord issues, and medical complications with the mother. So if we look at the data across the United States, again, we know that stillbirth is a significant issue. It's a tragedy, but it's rarely talked about. And it's a lot more common than people think. 1 in 169 pregnancies will end in a stillbirth. And the racial disparities are large. For Black women, it's 1 in 96. Black women are 2 times, sometimes 3 times, depending on the state, more likely to experience a stillbirth over their white counterpart. Hispanic, Latinx moms, 1 in 199, Indigenous moms, 1 in 138, white women, 1 in 204, Asian Pacific Islanders, 1 in 233. So again, it's just as prevalent as infant mortality, and families are 10 times more likely to lose a baby to stillbirth than to SIDS. If we look at North Dakota numbers, so this comes from CDC Wonder, And based on the most 5-year average through 2019, the stillbirth rate in North Dakota is 5.87 per 1,000 live births. So if you look at that chart there, you can see North Dakota is that red line, the US is that teal line, and then Iowa is that yellow line. So you can see the past couple years, it's increased slightly from 2019. We're waiting on 2020 and 21 data, but you kind of fluctuate back and forth between in comparison to the national stillbirth rate. On average, North Dakota loses 64 babies a year to stillbirth. And so if we implement this campaign and how we have done it in Iowa, which is what we're working on, what we're doing with the health department and with you all today, is we have a chance of saving 21 North Dakota babies on average that could be saved every year from preventable stillbirth. So you're probably wondering, how does she get that 1 in 3 number? How is she getting that 32%? We've had a 32% reduction in the number of stillbirths since the inception of our campaign in 2008. So you can see this chart here shows your Iowa data. Again, that's where we were founded in Iowa. And so in 2008, when we were founded, you can see the dot there was very high, the highest on record from that chart there. It's slightly higher, it looks like, than 2005. And then Count the Kicks was created, and we've had a downward trend since 2008. And public health officials have said that there really isn't anything else going on in Iowa that would have made such a significant impact. It's not like every pregnant woman got a doula, which would be amazing and wonderful. It's not like smoking has decreased. In fact, in Iowa, smoking has actually increased among women in the 3rd trimester. So this is what we're seeing. We're seeing 1 in 3 at-risk babies are being saved by stillbirth prevention, Count the Kicks. And then you can see that US there. I'm not sure what happened with the US rate there in 2019 and our rate. Years fluctuate. Things like a syphilis outbreak, a pandemic can all impact the stillbirth rate. So we're really looking at that trend line to continue to decrease. And then we know that preliminary data for 2021, which is huge for us because, that would have the, a year and a half worth of COVID data in there, which we're all concerned about with stillbirths and among other things. We're back at 4.1 fetal deaths per 1,000 live births. Our lowest on record is 3.9 in 2018. So just some things to think about. And I wanted to give you that picture of why I keep talking about 1 in 3 at-risk babies and that 32% reduction. It's because that's what we've seen in Iowa and how we've been successful is what we're trying to replicate in our other states like North Dakota. So I just want to spend a couple minutes on why there are such large disparities for stillbirth. And so this is specific to African-American and Black women. And I think it's really important to understand why this is happening and think through what can you do to close those gaps. So things like that are causing these disparities are things like systemic racism, toxic stress. We know research shows that years of being treated unequally and or unfairly, essentially being an African-American woman in a systemically unjust society has led to real and pervasive health issues. Epigenetics, those physiological variations that are caused by external or environmental factors, predisposition to certain conditions that may lead to stillbirth like gestational diabetes. Experts say Black women are less likely than other races to receive early treatment for those conditions. Access to healthcare, socioeconomic barriers. Research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school educated white woman. So some of the things that we have been doing to reduce those disparities is we have a health equity coordinator on staff. We are always looking for funding opportunities to reduce racial disparities that exist. We're an inclusive organization with 100% board and staff trained on anti-oppression and structural racism. We are improving our program based on lived experiences of women of color. We work within marginalized communities. We have an app in actually over 12 languages now, culturally appropriate educational material. So if you work with a lot of different populations and demographics and cultures, and there are some pieces that we do not have for you, they're either not translated or you have questions about, let us know, because that is something that we can share with our our friends at the state and say, hey, this is what we're seeing as a need. Can you help us get this? That's what we want to do. We want to make sure you're successful in sharing this information with the people you treat and people you see. So the next couple slides, what I want to do is just kind of highlight some of the research of this entire campaign and how it is truly evidence-based. If you're really into research and journal articles and things like that, we have a whole page on our website dedicated to evidence. And so you can read various journal articles, things like that. But if there's one journal article you ever read, I would love for you to read the one that you see on your screen. And that's because this is the one that started it all. This is the research study out of Norway that our 5 founders who are all Central Iowa women. They all experienced stillbirth or infant loss in the early 2000s, and they didn't know each other at the time of their loss, right? Iowa's not that big, Des Moines not that big, and they got connected through pastors and friends. And as they started meeting for coffee and kind of grieving together, what they noticed was here they all sat with very similar stories and being told that this is not that common. And yet here they all sat where they all experienced this relatively around the same time frame. So long story short, they went to a public health conference on stillbirth, and they heard about this study out of Norway that showed when expectant parents were educated on the importance of tracking fetal movement in the 3rd trimester of pregnancy, that the stillbirth rate decreased around 30% among this cohort. And so as they came back to Iowa with this knowledge and this research and this evidence, along with other articles, the founders had said, we can do this. We can create an evidence-based stillbirth prevention campaign that, Kit County's been around forever, but not the tools and resources for providers to talk about this with their patients, for healthcare workers, for community-based organizations to understand the importance of tracking fetal movement and how to talk about it, and tools and resources for expectant parents to be educated on and to be empowered to speak up if they notice a change. And so that's what they did. They worked with the public health, Iowa Department of Public Health, and a local marketing company. And knowing loss themselves, they wanted to create a bright and colorful, empowering campaign that people would want to talk about, that people would want to share. And that's how Count the Kicks was created in 2008. So this quote here is from Dr. Ruth Fritz. She was on that original research out of Norway that did show that reduction. And she says, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the 3rd trimester. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern starting at 28 weeks and to speak up if they notice a change. And so throughout the rest of the presentation, you're going to hear me talk a lot about normal movement pattern and what that normal means. That will be very important as you take this back to your team, take this back to your clients and patients to really understand what we're talking about here with this and what that really means. So, but before we go that, I think it's also important to know there's other pieces out there that have solidified us, that have, we have that credibility that is research backed, it's evidence based. So the Association of Maternal Child Health Programs, they have done a scientific review of the program. They look at a variety of different things, making sure that equity is at the center of it. Research based, evidence based, the ability to be replicated with positive results. And so they named us a best practice in January 2021. If you're familiar with the Hear Her campaign, CDC, they added one of the warning signs is baby's movement stopping or slowing down. So they know just how important it is, and we've had conversations with them. And then some other research findings, I think some of the questions is, this is just going to increase anxiety in my patients. They're going to be calling all the time. And I can tell you that does not happen. Here is a quote from a research study that says, one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in hospital. However, most research has not found this type of increase to be true. Usually the fetal movement count is reassuring to pregnant women that prevents unnecessary visits. Because if you think about it, now we have an educated group of individuals who understand their baby's normal. And so they know when to speak up versus just, oh, I'm not sure, I better call. They trust their gut and they have the data, they're ready, you know, they're empowered to speak up. We have also done our own study with Des Moines University and the Harkin Institute, and some of the preliminary findings where we did a study of our actual app users. And over the course of several years, 84% of the app users stated that regular tracking was associated with feelings of bonding. And 77% of app users reported feeling less anxious. The researchers stated that using a mobile health app to empower mothers to monitor their baby's fetal movement, that preliminary research shows the mobile health app increased awareness of a change in fetal movement and a reduction in stillbirth. Some other benefits that I just don't think people necessarily think about that I want to stress are things like reduction of preterm birth rate, fetal growth restrictions are identified earlier. We know that, you know, from research, they bond with baby and significant others can bond with baby. You can include siblings. Maybe it's an indicator, you know, reduced fetal movement that mom is experiencing a health issue. There's research out there that shows that stillbirths, women who have stillbirths are substantially higher risk for severe maternal morbidity than women who have live births, regardless of the cause of fetal death. So I love this quote from this research who said, due to the low cost and potential benefit, it is recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. So again, additional research, we have a lot out there on our website that you can view and read through and just, yeah, if you're interested in that. So now let's get into the heart of it. How do you implement this and what exactly is it and what does it entail? So one of the things I want you to do right now, if you haven't already, is I want you to multitask, which I know is weird coming from a presenter that you're supposed to be paying attention to, but I would love for you to, while I'm talking about the app, is to take out your smartphone if you can, if you're able, and search in your app store, either, you know, if it's an iPhone or iOS store or your Google Play Store, search Count the Kicks and download the app. And I want you to do this because I want you to use it. I want you to, if you're not pregnant, I want you to pretend you're pregnant. I want you to pretend to count for twins. I just want you to become familiar with it. And so you can see truly how easy it is, so that when you do share this with your expectant parents, your patients and clients, you can say, look how easy this is. Let's go ahead and do this together while you're waiting and get you connected to this. It's completely free. There are no ads or no pop-ups other than a daily message that is all referencing the importance of this and reminders. It comes in 14 languages that you can see there on your screen. You can restart your session or delete a kick. So how it works is starting at 28 weeks or 26 weeks if they're high risk. Once somebody downloads the app, they'll get through kind of like a how-to tutorial, just a couple slides on how to use the app. When they're ready to start counting, and we want people to count daily, so that's something you want to stress with your expectant parents, preferably around the same time each day. So think through when baby's most active, choose that time. And all they have to do is hit that big red button that says start counting. And then they'll see that screen with that teal footprint. And when they're ready to start, when they're ready to track that first movement, and they say, okay, that's the movement I'm going to start. They feel the movement, they tap the footprint and a timer will start. They tap that footprint on their screen every single time they feel a movement, jabs, pokes, rolls. They do that until they get to 10. And after they get to 10, the timer will stop and they will be shown a graph, very much like the one you see behind you or behind that image on the screen. And so what this does is it gives a very good visualization for the user, just what their baby's normal is. After a couple sessions, the user will be able to see what is normal for their baby and see the average time it takes baby to get to 10 movements. So again, they're visually going to see that chart jump up if it takes significantly longer. And that's what, you know, they're going to say, oh, that's not my baby's normal. I need to contact my provider. So that's how simple and easy it is to use. One of my favorite features is setting those daily reminders. So we're busy. We're a busy culture. We're busy in a pandemic. We're just busy. We have things going on. And so In the app, they can set daily reminders. They don't have to go through their calendar. It's all internal on the app. And then they'll get those notifications, right? That will say, hey, it's time to count your little kicker, just fun little messages like that as a reminder. So I would definitely encourage them to do that as well, to set that up. They can review kick counting history. They can download their history. This is a really important feature. People can do this and download it and take it to their next doctor's appointment. They can upload it into like a MyChart system so their provider can see it at any time. They can share it with family and friends. There's just a lot of different ways. And, I know, it kind of seems like the pandemic ebbs and flows and, whatever that looks like in the future. But as telehealth appointments are becoming more and more popular, or we get into something with the pandemic where that's what people are doing. I don't know if you saw that in North Dakota in the height of it, but that's what we were seeing. And so just making sure that they know they can always contact their provider, they can always share this with their provider, and that the provider wants to see this and should want to see this. You can count for singles or twins, manage multiple devices, and now it's available on the Apple smartwatches. So you could be counting or laying in bed, resting at 8:30 at night when your watch goes off saying it's time to count, and your phone, and you're 8 months pregnant and your phone is over on the dresser away from you. And you're like, I'm just going to count right here on my watch. So it's all connected. Another important feature. So if you are familiar with the app, but you haven't worked with it in a while, this is something new to you and new to everybody. This came on the market. We added this last summer, and we worked with researchers and providers because research shows that not only should expectant parents be paying attention to what their baby's normal movement pattern is, but they should also be paying attention to the strength of those movements. So after each session, what's going to happen is they're going to see that second screen there where it says, almost done. Please fill out the following fields to finalize your kick session. And then they have the option to color in 5 feet, if you will. If they click that little I by movement strength for information, they're going to get that strength tracking document there on the left that shows them what we mean by this slide. And they can fill in 1 through 5, basically, 1 being, movements were very soft and subtle. You could, barely feel them, all the way to fierce. So maybe, they saw movements on the outside and it's very easy to see limbs poking out and things like that. What's really important about this is to note that the strength really should not become weaker, right? That should not decrease. And so what they'll see is a bar graph showing their strength. They'll see their session, and then they'll see the average movement strength. So for this example, you can see it's normally around 4 or 5 feet are filled in. And then all of a sudden it looks like that last session there at the end, the movement strength decreased and the movements took longer. I'm not saying that those have to, connect. I'm not saying that both have to happen. I'm just saying this is just an example. I think the important thing to share with your patients is the fact that if there's any significant change, whether it's in strength or how long it takes baby to get to 10 movements, if that has changed significantly, if that's different than their normal movement pattern, to call their provider. And especially in rural areas, which I know North Dakota is very similar to Iowa like that. If people have a 60-minute drive or 45-minute drive, we know hours and minutes matter. So making sure they know they should not wait the next day for a voicemail, or to get called back. If they have concerns, baby's not moving like normal, they need to go in and they need to start heading that way. So I just wanted to share that was a new feature. Oh, we also have that notes section. So they can have notes, they can share those with the providers as well. Now we also have video capability, meaning we have the option to watch videos, not all of our videos, because we do have a lot, but some of the key ones that I think are really informative regarding the app and the importance of tracking fetal movement. So if you do work with childbirth ed, or you have ability to have these shown on your, maybe you have rolling, videos on a TV monitor in a patient room or in the waiting room, share these, that would be awesome. So those are on as well. And then another new resource that we just launched this year is our Find Help resource. And so what users can do is they can search via their zip code. They just enter their zip code in the search box. I did an example for where I live in Johnston. And they can find free or reduced cost services. So maybe they need food assistance or housing assistance or childcare. They can find that. They can look at a map within that. It's all on the app, and it's also on our website that they can access this. So they can find all the resources available to them that are free or reduced costs close to them. And then really quickly, I wanted to share this really easy how-to tutorial of the app and how she is using it. And this is something, again, you could share with your clients and patients.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
So super simple and easy to share that. So now let's talk about how you can integrate this and how you can talk about this with your patients, because we understand nobody wants to talk about stillbirth. So you want to be talking about this around 26 weeks if you're working with patients or clients that are high risk, or 28 weeks otherwise. And you really want to use those motivational interviewing techniques. So open-ended questions, sort of. Do you know about the importance of tracking your baby's movements? Let's talk about how to track your baby's movements, and talking through that movements are jabs, rolls, pushes, no hiccups, because hiccups are involuntary, so they don't count. Sharing the app. If a lot of you, or if any of you work in a clinical setting, here in Iowa, we have to do our glucose test in the clinic. I think we get our blood drawn. It's been a couple years for me. We do our blood draw, we take the liquid, and then we do a blood draw an hour later. So we just sit in the waiting room. That's a perfect opportunity to say, hey, while you're waiting, go ahead and read this brochure. And then download the app while you're waiting, and we'll talk about it when you come back, at your 10-minute appointment there after the second blood draw. So just an idea to have. So I want you to be thinking through those ways you can easily integrate this as I'm talking. So again, we know it's scary, but we also understand that pregnancy is full of risks that we talk to people about. Stillbirth is another risk that moms deserve to be educated about. Stillbirth just happens. There's nothing we can do. There actually are warning signs if people know what to look for. Decreased fetal movement is one of the earliest and sometimes only warning sign that baby's in distress. Here's a big one that you'll probably hear actually from patients or clients. Oh, I don't need to do this. My baby's always active. It's like a jungle gym in there. It's not a concern. And I'm always like, that's wonderful. A healthy baby is an active baby. But I think it's still important to track baby's movements, because cord and placental accidents can be sudden. And so you need to know if your normally active baby has changed in time and strength and things like that, versus second guessing yourself. This one's outdated. She's almost at her due date. We know that the risk of stillbirth actually increases as mom approaches or exceeds her due date. So what about talking to people who have had a stillbirth before about this? And I think it's, we want to be talking to every expectant parent, not just high risk, but you would follow the same protocol, since women who have had a stillbirth are more likely to experience another stillbirth. You do want to start talking about tracking baby's movements around 26 weeks. Feel free to talk about the previous stillbirth and acknowledge her child that was born still. If you were not her provider or you just found out about it, if you're like a WIC consultant or home visitor, ask about the name, the gender, be empathetic. I think, staying away from medical terms like fetal demise is really important. And then ask if they have ever been talked to about the importance of tracking fetal movement. A lot of people we've talked to that have had live births and then they've had like their third or fourth pregnancy has been a stillbirth, and they said, why didn't I know about this? How come nobody told me the importance of this? I did notice reduced fetal movement. I did not know why it was important to speak up. And so what we want to do is we really want to address those why didn't I know, and make sure that we are addressing them and saying, we want you to come in. We want to hear from you. We want you to speak up. So some other common myths that you might hear, or maybe you have yourself, who knows? Again, this goes to the high risk. I can't emphasize this enough. We want every single expectant parent you talk to, whether you are a provider, a nurse, a community-based organization, you do not have to be a medical provider to talk about this and to educate on Count the Kicks, to get to know it's normal. This is a very popular one. It's very easy to remember. It's very easy to say 10 and 2, 10 kicks in 2 hours. I've even heard 10 and 1. I think this is where, again, that normal, we want to know what's normal for their baby. Every baby's different, and the 10 and 2 is actually outdated. Current research indicates that moms should work to understand the normal amount of time each day it takes their baby to get to 10 movements. There's a research study on our website about this, and basically what it says is, as humans, we really focus on that time, right? Like that's going to be our standard. So if we get told 10 and 2 and we know we should get 10 kicks in 2 hours, what we'll do most of the time, this is what the research study has shown, is that let's say I'm counting and it takes 15 minutes normally. I know that's my baby's normal. And then all of a sudden it takes the next day, I'm counting and it took an hour and 47 minutes. And I think to myself, well, that's totally okay because I got it within 2 hours. But that's not, right? That's a significant change. My baby normally takes 15 minutes or 20 minutes, not an hour and 47 minutes. So, really getting to the fact that we want to know what's normal for their baby, that every single baby is different. Every pregnancy is different. I have 3 children. I have a 9, 6, and 3-year-old. And I can tell you my 9 and 3-year-old, they were both very active. I was the one that was like, I don't need to count, things like that. And, this was before the app and everything. So I knew it was important to count, but I didn't connect the dots of why. And, they would get their 10 movements in 5 minutes or less. My daughter, on the other hand, she took 30 minutes. And I remember calling triage. I remember going in a couple of times to make sure baby was okay. And they were more than welcome, welcoming to say, yes, come get baby checked out. Everything checked out okay. I just needed to know that that was her normal, right? Like it took her 25 to 30 minutes to get to 10 movements. I needed to understand that that was her normal and not compare her to my other pregnancies. I can just use a Doppler device to monitor my baby's well-being. A change, again, of baby's heartbeat is one of the last things that occurs when a baby's in distress. And a change in baby's movements may indicate a potential problem before the actual change in the heart rate. That's why we really do not recommend using a Doppler device under, with nothing else, like under the guidance of healthcare. And even when people go in with reduced fetal movement, that is not protocol, right? You should not just be, as a provider, just doing a Doppler and sending them on their way. No, you're doing further testing, right? So I think that's important to know. Here's another old one. I was just talking on the phone with somebody about this morning. And she said, if somebody calls with reduced fetal movement, we have them drink orange juice and, eat something and, let us know. And research has really moved away from this idea. Kick counts are best monitored without interventions like juice or candy. If a baby is not moving like normal, parents should speak up to their provider right away. Because if you think about it, when you and I are sick, we do not like to move. We want to sit on the couch. We want to lay in bed. We want to watch Price is Right. We don't want to do much. The same with baby in utero. If something is going on with baby, whether it's infection, low amniotic fluid, whatever the cause, they're really conserving that energy, right? They're not moving as much, or something's constricting them from moving. So why are we trying to force baby to move with interventions? Let's see how baby moves normally and then decide what's going on. Babies kick less the end of pregnancy. You'll hear this a lot if you work with, those generational families and grandparents and great grandparents and, oh, the baby's just running out of room. It just changes, right? They get bigger. And the movements, though, should still take around the same amount of time to feel 10 movements. So that should not change. The movements might feel differently. And here I was talking to somebody earlier on this about triage and outpatients, and that's a perfect. And she said, yes, we give Count the Kicks education to our outpatient patients. So that's perfect. When I went to triage with my daughter, that's exactly what they gave me too, the Count the Kicks education. So that's a perfect time to hang these. So just remember to stress the importance of knowing their baby's normal and speaking up if there's a change, making sure they know who to call, and making sure that, especially if you're their provider or you're their nurse, and share this with the team, that you want to hear from them, right? Like that's their job. And I can tell you, and you probably do this too with your own health issues, like you don't want to bother people, you don't want to go in, let your patient know that's what you're there for. And that's what providers are there for. So no matter what time or day or night, and that goes for any issue, right? Whether it's bleeding, contractions, whatever it is, you want to hear from them. We'll talk about the free material here in a second, but send the brochure home with them, post the posters around the clinic and the waiting rooms, libraries, etc. Sharing that research shows evening is usually the best time to count. However, that's not a deal breaker. I know people work multiple shifts, so just let them know, to pick a time when baby's most active. And then again, those open-ended, how is it going? Tell me about your baby's movements. Can you share the graph? Like, let's talk about this. This should take 3 to 5 minutes. So it does not take long. Other ways to integrate as you're thinking through this, you could use a format check-in. You can make sure everybody who answers the phone is trained to triage this immediately to a nurse or provider. If you are a home visitor or WIC consultant, could you add verbiage to an intake form or family care team meeting? We talked about the glucose. And then my favorite is, how could you integrate this into electronic health records? How could you integrate this so you get a pop-up that says, oh, 28 weeks, time to talk about Count the Kicks. And you should do this at every single appointment in the 3rd trimester. Or if you don't see them all the time, you want to do it every time you see them in the 3rd trimester. Here is an example. I was talking to that gal earlier. This is kind of our gold standard. So if you do have the ability to update your after visit summary, so when somebody does come in, and these are what some hospital systems are implementing that we're trying to work through. And we have this whole draft here about Count the Kicks, and they integrated this. They even linked our print counting charts, our free downloadable charts, into their Epic system. So if you're interested in that, send me a message. I'd be happy to talk through how to do that. Super simple and easy. So again, this is more about electronic medical records. I'm really big about systems change. So how can I work with you to make sure that this is something that you have to remind yourself to do, that it just comes second nature. So every single appointment. This is baby Margot. She was saved when out of Ohio, her OB office shared the Count the Kicks information with her through posters and room walls. Because remember, the more touch points with the mom, the better. So put it in your restroom, put it in your waiting room, put it in your front desk, the brochures. There's lots of different ways you can share this. If you're more of a home visitor or work more within the community and you have some sort of intake or form, this is an example out of Ohio that we implemented. They serve around 2,000 expectant parents every year. So this is a great way to they have a one-stop shop. Basically, they see them once and then they move on, but at least they're touching base on it. At least they're talking about it. So now my favorite, I'm gonna give you just like a minute or two to actually click on the link here, go to order materials and order your materials. You can get a promo poster in English and Spanish, however many you need. How many restrooms do you have? How many patient rooms do you have? The how-to poster, which you see here on your screen, is great. The app reminder cards, brochures, completely free thanks to our partnership. You can scan the QR code there. You just click on order materials and go ahead and do that. I'm going to play this song for just a couple minutes, and then you're going to come back and you're going to be entered. If you make an order, you can be entered to win an Amazon gift card. So chances are good that you might win because there's about 5 of you on today. So yeah, go ahead and place an order. Remember, if you're out in the community a lot, keep a stash in your car. These are great for libraries to post, chambers of commerce. So I'm going to give you just a minute to do that. So let's listen. Don't go away. Come back. Again, I'll know if you enter, make a order, and then I'll do a drawing for, I'll send you an email with the winner.
It might seem crazy what I'm about to say. Sunshine, she's here, you can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Well, give me all you got and don't hold it back. Well, I should probably warn you, I'll be just fine. No offense to you, don't waste your time. Here's why. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want.
Okay, I'm going to stop there. Hopefully you placed your order and you'll be entered to win an Amazon gift card. So we'll go ahead. Oh, I don't know what's going on.
Okay.
There we go. We also have an online training. Don't worry about writing this long link down. I will send it via email to everybody that registered. But this is a 90-minute online CE training for free. You use that code. This is 1.5 CEs and something that it's very similar to what you did today. It's just longer. And you actually read that research article that we talked about in a couple other ways. We have a big equity portion of it now that we'll be posting as well. Other free resources, we have parent provider academies, kid counting charts in English and Spanish and Haitian Creole. Again, lots of those videos. And then why do we do this? These baby saves. And I should have, what I should have done is you have your own North Dakota baby save that just happened. So baby Isla. So I will send that in the email as well. She was saved, I think, in the Bismarck area. So if you've heard that story on the news, it went around. So that was really excited. Her provider told her about Count the Kicks. She noticed reduced fetal movement, spoke up, went in, baby needed to be born. And so she's here and thriving. And that's what we like to see. But today I'll go ahead and show you Nala, who was saved a couple years ago, and we'll end on that note.
She came back in after she had me put on the monitor and stuff, and she's like, we're just gonna take her. And I'm like, what? And she's like, her heart rate is dropping every time you have a contraction. I was already scared, because I was a high-risk pregnancy. So I basically learned from the doctor's office, the little yellow sign that was right there. When she started moving, I was very alert with her movements, That was what I lived for, just because I wanted her to, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if? Definitely to pay attention and count the kicks, you know. I feel like it's important just because had I not, you know, knew to do that, Nala wouldn't be here. Don't second guess yourself, don't feel bad or stupid, don't worry about insurance or the emergency room bill, go check on your baby, you know, because your baby might not be here. You just pay attention, you know, seriously, like, it's your baby's life.
So I really like what Dana says, where she's like, don't feel bad or stupid, go check on your baby. It's your baby's life. And that's really the message, right? So next steps are become familiar with the app. You downloaded it, so now just mess around with it. You ordered materials already. Maybe designate someone in your office to oversee ordering materials so you don't always have to remember. Again, this should take 3 to 5 minutes to educate on, making sure your entire team knows about it. When I send out the recording, feel free to share it with them. Using those EHRs, EMRs, intake forms, any way you can easily integrate this. Remember, hours and minutes matter in preventing stillbirth. Educating patients and staff on how to expedite concerns about movement is really, really important as well. And with that, I'm going to share my contact information one more time so you can have it, but I'm happy to answer any questions. You're all muted, but you can raise your hand and I can unmute you. You can use the chat box if you want. But just thank you so much for your time. Thank you to the North Dakota Department of Health for bringing us to North Dakota. We're really excited, and I'm excited that you participated today and that you'll be able to share this with the people that you work with. So I'm happy to take any questions. And if there's no questions, you can enjoy the rest of your lunch hour. And I don't know about you all, but in Iowa here, it's supposed to be in the 50s. So it's going to be pretty nice. We're short like you all. We'll probably walk around in shorts and stuff like that. So thank you so much for your time today. Thanks, Emily.